Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
At some point throughout your life, you will experience bloating. Some people have chronic bloating, and I want to talk about what it is that is generating this effect and what you can be doing, because bloating is certainly not a fun experience. And when we look at the statistics on bloating, we know that this is a major problem for so many people on a daily basis. So I'm Amanda Williams, MD, MPH, and let's talk about bloating. We've all probably heard people use that term, oh, I feel so bloated, or oh, I just ate this heavy meal and now I feel bloated. You yourself may have experienced it where you feel a little bit more rounder through that abdomen area. Now, keep in mind that bloating is not the same thing as belly fat. So having excess belly fat is one thing. Having bloating is something completely different. Bloating occurs when the GI tract is filled with air or gas. And this is oftentimes driven up and associated with constipation. So we have to start to look at what is the main issue. And we can certainly look at the pathophysiology of this and understand that our microbiome is playing a significant role into this. So looking at the epidemiological studies on bloating, we can estimate that roughly about 30% of the U.S. population experiences bloating on a regular basis. And we also understand that when we look at irritable bowel syndrome and we look at issues with constipation, we see this higher prevalence of bloating. So those who have the constipation form of IBS are more likely to experience the bloating as well, as opposed to those who have more of the diarrhea predominant IBS. And understanding the underlying cause is really important. So this is where we have to look at that gut microbiome. We have to understand the gas production that is generated by some of these bad bacteria. We have to look at the intestinal transport of foods throughout our GI tract. This is kind of like a staging effect. And if one thing gets screwed up along that staging effect, then you can start to see how we can have all of these other kind of issues start to back up within the system. And we have to be able to zero in on things that we know are likely culprits or triggers to bloating. So we can certainly look at the bad foods that most people are eating, that lack of fiber that comes from the foods that most people are eating, those highly ultra-processed foods. We can certainly look at drinking the carbonated beverages. So while a lot of people like the little bubbly drinks, oftentimes these can help to, once again, generate a lot of that gas, which can then lead to the bloating. We can look at remedies for that, which would be trying to utilize something like green tea or white tea, as opposed to having a soda. We know that things like chewing gum or drinking out of a straw, these are also ways that can drive up bloating. And we have to take a multifunctional approach when it comes to bloating and being able to target this by, number one, targeting the microbiome. So a good multi-strain probiotics such as the probiotic HX, for example. This is certainly an area that we want to to reestablish, we want to lay down good, healthy bacteria once again. We have to make those dietary changes because if someone is dealing with something like IBS with constipation and bloating, well, we need to make sure that we're incorporating high fiber foods into the diet each and every single day. So that's fruit and vegetables. This is important. We have to make sure that we are taking in the appropriate liquids. So most Americans walk around in a state of dehydration. So staying adequately hydrated, but with the right things. So whether that's, taking the purples HX or the oranges HX every day instead of drinking a juice in the morning, this would be a better option. And then throughout the day, having green or white tea. So using the green tea TX or the white tea TX is a really nice way because we certainly recognize that green tea has a really nice ability to kind of allow the GI tract to have better movement. And at the same time, that green tea certainly works lovely, the EGCG within that, with the good healthy bacteria that you would find in the probiotic HX. So we look at that and then we say, well, what else can we be doing? So we can look at taking a probiotic, we can look at green tea. Well, then we have to think about digestive enzymes. This is really very important. For a lot of folks, they just accept bloating after a meal as just normal, and it's not. So I always say, include in digestive enzymes. As we get older, our body becomes less efficient at making those digestive enzymes, the things like amylase and protease and lipase. So taking digestive HX, one capsule just before you eat, will really allow the body to do a much more efficient job at the digestion of the foods that you are taking in. And then we look at other things that we know are very supportive to the intestinal environment, which would include things like vitamin C and magnesium. For many people, if they're lacking in those two, which we know is fairly common, this certainly can be a trigger as well. So when we incorporate in higher fluid intake, higher fiber intake, of course, a good multi-strain probiotic, digestive enzymes, some magnesium, some vitamin C, we can start to see that we are creating a significantly higher amount of balance back into the GI tract. Now, when we think about normal gases that are produced within the intestinal tract, yes, there's always a normal amount of intestinal gases. But what happens in the setting of bloating is this is actually more of an abnormal, heightened level of these gases that are building up. And this is where the issue is kind of driving when we have any type of abdominal distension or bloating that arises. And so for many people who experience this, they complain about this. Gosh, I'm in a lot of pain, or this is very uncomfortable. And so we want to make sure that we can try to create more of a balance or a homeostasis within the GI tract. And so this is why we want to change our diet. We want to make sure that we're exercising. We want to make sure that we're taking in high fiber foods, and we're taking green tea and magnesium on a regular basis, along with that probiotic and those digestive enzymes. Because when it comes to bloating, this is something that we definitely want to avoid. We know that so many people are prone to this, and you always want to rule out, is there something else going on within the GI tract? Is there a situation, maybe you were on an antibiotic and now we have a small intestinal bacterial overgrowth known as SIBO? Is there potentially a problem with H. pylori that is driving up this higher gas and acid environment within the stomach? So you always want to do due diligence to rule out any underlying major issue. But if it's coming down to self-induced because of the foods, because of lack of nutrients, because of being slightly dehydrated, those are the things that we want to make sure that we work on each and every single day so that we can avoid becoming one of the numerous statistics when it comes to GI bloating. So that is all that I have for you for today. I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram, and we will see you next time for another episode of the Invite Health podcast.